Well, hello everybody and welcome to this month's video message. This is a very special message because we're going to explore the preparation that's now well underway for our forthcoming CQC regulation inspection. Now, those of you that were here in 2014 will know that we did a lot of work and we got a very good result, which was very satisfying and also very reassuring for our patients. But here we go again. I'm absolutely confident that we will have a good result, but we need to put the preparation in. So let's meet the people who are leading that work. Those of us that were here last time will remember that about 50 inspectors came for a week.
That's right.
And this isn't going to be quite the same, is it? So tell us what's going to happen over the next 6 or 8 weeks.
The first wave is underway at the moment, where the CQC is meeting with colleagues from the Trust in small focus groups.
Yeah.
What's happening next between now and the 10th of July, the CQC is going to come in and do some spot inspections of some of our core services. We don't know which ones, so everybody needs to be prepared. Our process for the CQC arriving is on TrustNet. We call it Code Purple.
Yeah.
So do look out and make sure all of your areas have your Code Purple process on your walls.
Yeah.
And on the front reception desks at both sites. And that's got a cascade that tells us who to call any time of day or night that the CQC is here. And then after that, the CQC is coming back to speak about how well led we are.
There's also another inspection on the 6th of July, I think, which is something called a review of the use of resources.
Yes. That's looking at how we run some of those more business sides of the hospital.
Okay. How are you going about putting together a set of support mechanisms and interactions with the team to help everybody get prepared?
We have a series of leaflets and information booklets. We've got drop-in sessions. People can call for support. And equally important, all of this information is available from the regulation webpage on TrustNet. So look there to find out more.
What are the areas of practice in relation to the regulations you think we all need to be focusing on in terms of improving and just making sure we've got sorted as these inspections approach?
Medicines management is clearly at the top of our list.
Yeah.
I think we should be looking at how we store our medicines.
Yeah.
Doors are locked where you have IV fluids and other medications. A particular concern around CD drugs. It's one of those important areas that we manage, and we have to pay particular attention to how we do the documentation, how we sign them in and out, where our CD registers are. Usually they ought to be locked away in your CD cupboard and not left on the desktops. The other things I think our colleagues would be really familiar with is we are pushed for space. We fully appreciate that. But what I would say is make sure that you visit your areas, you have a look at your fire exit doors, and if there's anything in the way, try take them away, remove them and store them elsewhere. If you can't store them on the ward, then have a conversation with your line managers or the matrons for the ward areas where we can remove them too for you.
Okay.
Is your equipment being checked? Basic equipment like your oxygen masks that hang at the back of the bed, your suction equipment, your flow meters, your resuscitation trolley. So all of those checks that we do on a daily basis, ensure that you have paid particular attention to them, ensure that they are documented somewhere. And if you haven't been able to check them, have a reason why you haven't been able to check them.
Actually documenting why there'd be a blank on the documentation rather than just leaving it blank, because it leads them to believe that we're just not doing it.
Absolutely.
Okay, understood.
Absolutely. One of the things that were found last time when the CQC arrived was that our medical records were left out and not really secured or locked away. However, make sure the care planning needs for each individual patient has been done, updated, and if you're not using the care planning documentation, because that does happen as well, make sure it's documented in the notes somewhere. Why? Know your risks in your area, so be familiar with your risk register for your area. Know that you're doing your Perfect Ward. You're using the Perfect Ward app now currently to undertake a number of audits around experience, safety, quality in your area. So those are the things I would ask you to pay particular attention to.
That's really good advice, Sue. And I suppose just to reassure colleagues, because that big list of things sounds a bit scary, doesn't it?
It does.
And actually, my sense around this is that This is our opportunity as an organisation to be outstanding. So this is about refining our position and tuning it up. Am I right?
We do so many good things in this organisation when we need to start to tell our story on what we do. The QI work that's going on in most ward areas, it's all in response to something staff have noticed that they want to improve, and they have an appetite to improve that. And I think that if you just pay attention to the basics, you'll be able to then tell your story really well, really loud, and really proud about what it is you're doing on your ward areas.
Talk about the great work you've done, talk about how things were and how you've changed them for the better for patients and how patients have been involved, and just be very proud, because I think we've done a great job over the last 4 years.
I'd agree with that. I mean, having a CQC inspection makes us all feel a little bit anxious, doesn't it? And I'm sure you're right that actually the work that we've done in the intervening years should actually give us a lot of confidence. And actually we're not just making that up, because we see it in data, we see it in external reviews and reports.
Take the CQC and show them the great bit of work that you've done. But I think talk about it in the team beforehand and just get ready for that. You know, we've met the CQC, and the CQC are saying exactly the same thing, that, you know, let your staff show us how brilliant they are. And I think that's what we should try and do.
So, get along to the support, use the internet for information, go to the focus groups, have the team discussions and debates. We're here to support you, and please be honest, be open, and most of all, be proud.